The Injection Technique Matters Board are a group of specialist nurse advisors. We have developed 3 tools to help support your injection therapy. These include the Best Practice Guideline document, where advice is provided under 3 key headings. Delivery of your injectable therapies, including storage, preparation, needle length, site rotation, injection procedure and needle reuse. We then go on to injectable therapy challenges, which includes lipohypertrophy, how to examine for lipos, bleeding and bruising and pregnancy. And the third and final stage is sharp safety, where we look at the safe environment, disposal of sharps and sharp safety. Alongside the guideline document, we have developed a handy toolkit folder with key information included. Finally, a checklist has been developed to make sure you are getting the best from your injectable therapy. We hope you find the tools informative and easy to use, and we welcome any feedback.
I'd like to explain to you why I think the Injection Technique Matters initiative is important. We know that in the UK there is 4.2 million people who are diagnosed with diabetes, but a further million possibly are out there who don't know they have it yet. And within that number, we know that 20 to 30% of all people with diabetes in the UK are insulin treated. So that's about 1 million people using injectable therapies, which includes both insulin and GLP-1 receptor agonists to treat their diabetes. Unfortunately, diabetes is still going up year on year, and between 1991 and 2010, the people using insulin trebled, and we actually spend quite a lot of money on diabetes medications and blood testing products in England every year. So we want to make sure that you are getting the best use of those medications to help you look after your diabetes. The correct injection technique is really important because insulin is rarely, if ever, given at the right time, in the right way, or in the right amount. So it is therefore amazing that anyone with diabetes has any semblance of good blood glucose control. Now that's a quote that is very often used, and this was a guy who was a very prominent healthcare professional working in diabetes, but this was going back over 20 years ago. But unfortunately, we still have the same problem. So we want to make sure that everybody who is injecting insulin or GLP-1 therapy knows how to give that insulin, where they give it, how they give it, and making sure that they're using it in the correct way to prevent any long-term complications as well as any short-term complications. The importance of good injection technique is the following. We need to ensure that there is the correct needle length, correct resuspension of insulin if it's a cloudy type of insulin, to use the correct injection sites, to use a correct rotation technique, and that we only use needles once. And we also need to make sure that we're using the correct angle of the needle as it's inserted into the skin, and using a lifted skin fold if necessary. But crucially, we need to be ensuring that the site where the injections are given is examined on a regular basis to check for any lumpy, bumpy areas, which is called lipohypertrophy. As you can see on this slide, we're really giving you some idea of the following steps that need to be taken to ensure that glycemic variation due to poor injection technique is minimised. It's really important to check these steps in your own technique to maintain the lowest possible effect of poor injection technique. If you have any issues regarding these steps, please talk to your doctor or nurse.